Hi, everyone. It's great to be with you all, and thank you for joining for this afternoon or this morning, depending on where you are. This episode of Healthy Moms, Strong Babies. We are so pleased to bring this discussion to you today. My name is Stacy Stewart. I'm President and CEO of the March Dimes, and we've been doing this series now over the course of the pandemic, and it's been, we think, and we hope, incredibly helpful to get information out to everyone, especially moms, pregnant mothers, breastfeeding mothers, new moms, families, grandparents, and everyone, to just manage through a pandemic, which has been really quite a burden for a lot of us, and very difficult to manage with all of the information that comes out, all the changing things that happen on a daily basis. You have an opportunity to look at the news and get your information that way. But we hope at the March Times we can also be a source of really credible and trusted information for you. We have the ability to engage, as you will hear in this one, and if you've listened to any of these before, some of the best people, the best experts, the most qualified and reputable people working on these issues that every day they're trying to address in terms of keeping us all safe in the pandemic. So I'm excited about today. I'm also excited that we have a chance to, at some level and in some way, celebrate the holidays and talk about what that looks like this year, since it probably won't look the way it's looked in years and years past. Hopefully it'll look, and we'll try to make it as normal as we possibly can, even though there are a lot of things that we have to consider just to keep ourselves safe and keep our families safe. And that's certainly what we're gonna talk about today, is how do we manage through the holiday season and manage in a way that keeps us all safe and helps prevent the spread of infection, helps prevent any one of our family members becoming severely ill. We certainly don't want to see our hospitalization rates increase because of the holiday season. Let me just say that before we move any further, to be very, very clear about this and the position that the March of Dimes has, and it is based on guidance released by the CDC. It is what you have heard from others, but we will repeat it again, that the best way to protect yourself and others from COVID-19 is to be vaccinated. And what we know is that to be vaccinated is to have had your 2 shots, or maybe your 1 shot, and to also have a booster. And while there aren't tons of mandates and requirements around the booster, it is absolutely being recommended that everyone get boosted if you're eligible, and if you can, please get boosted, especially as we're heading into this this holiday season. COVID-19 vaccines are safe for pregnant people, for breastfeeding women. They are not only safe, but they are effective in protecting against the virus. And again, the CDC has recommended that pregnant and breastfeeding people be vaccinated against COVID-19. Not to put a damper on the great conversation I think we're going to have, but it is important to level set for everyone that since the pandemic began, more than 127,000 pregnant women have contracted COVID-19. And that's just in the United States. 22,000 of them have been hospitalized for their infections. And more than 500 have needed intensive care. And 171 of them have actually died, which makes COVID-19 a leading cause of maternal mortality in the US in just the last 2 years. These are sobering statistics. They are real. It is very, very important that we protect breastfeeding and pregnant women and breastfeeding and pregnant people through this period. We know that early data from our surveillance systems, the V-Safe Pregnancy Registry, and VAERS, which is the system that collects a lot of the data around vaccine, the effects of the vaccine, we are seeing from all those systems, none of them indicate any obvious safety signals with respect to pregnancy or neonatal outcomes associated with the COVID-19 vaccines in the 3rd trimester of pregnancy. So we know that the vaccines are safe and can protect women and protect their babies. Again, get vaccinated, get your booster. We highly encourage that. So now I'm going to get off my soapbox a little bit, but we'll come back to that again, I'm sure, not only from me, but from others as well. But I am excited to get into this conversation because there are other things to consider, even beyond the vaccine, in terms of keeping ourselves safe. And that's what we're going to talk about today. We do want to remind you that if you are listening and you are on Facebook, you please, please, please put your comments, questions into the chat box. I will be seeing them. I will make sure that the panelists are able to address them, and we'll make sure to get all your questions answered. We've got plenty of time. We'll make sure to get through all of it. So let's get into it. I want to introduce our wonderful group of panelists who are going to talk about all of these issues. And we're going to be talking about the Omicron variant, which is on everybody's minds. It's the thing we're all hearing about. We want to make sure we all understand what that looks like for us and what we should be thinking about with respect to new variants of the COVID-19 that are appearing and that are affecting us even as we speak. So I'm going to first introduce Dr. Lee Beers. She is the current president of the American Academy of Pediatrics. She is professor of pediatrics and the medical director for community health and advocacy at Children's National Hospital here in Washington, D.C., where I also am. She is the founding director of the D.C. Mental Health Access and Pediatrics Program and co-director of the Early Childhood Innovation Network. So Dr. Beers, thanks for joining us. The chief pediatrician of the United States of America is with us. So if she can't answer the question about COVID-19 and your kids, God bless us all. We have no hope. She is the expert. Dr. Joy Baker is a board certified obstetrician and gynecologist based in LaGrange, Georgia. She has worked in both urban and rural communities for over 10 years after completing her medical school and residency training with honors from Morehouse School of Medicine and Grady Health System. She has her Morehouse mug just to prove her bona fides right there. Yep. And also, I say this all the time because I'm a proud former board member of Grady Health System. It is one of my most precious experiences in my life. So always glad to have a Grady friend on with us. Dr. Baker is considered in 2021. Remember what year it is? Georgia Trend's top doc. So she is a top doc in Georgia. In response to the COVID-19 pandemic, Dr. Baker pivoted to launch Delivering Joy MD on all social media platforms to connect virtually with her patients and others to provide reliable women's health information. So Dr. Baker, thanks for joining us. Steve Love is the current president and CEO of the Dallas-Fort Worth Hospital Council. The council's primary mission is to promote patient safety, quality healthcare, and coordination in the delivery of healthcare within the North Texas market. Steve has worked in healthcare management for over 40 years. Prior to joining the Dallas-Fort Worth Hospital Council, Steve has been and is a part of the Chairman's Committee for March for Babies. So he's been a close friend of March for Dimes for many, many years. And that's March for Babies, as you all know, is our movement to engage every single person in this country to make sure every mom and baby is healthy. So Steve, thanks for joining us as well. And then certainly last but not least is Amber Stevens-West. She may be, if others are not recognizable to you by face, she probably is, because she is a television and film actor currently starring in the Starz series Run the World, also known for her roles in Happy Together, The Carmichael Show, and Greek. Amber met her now husband, fellow actor Andrew West, while they were on the set of Greek, and today lives in LA with their two daughters, 3-year-old Ava and baby Winona. And baby Winona was just born in this past July. She can honestly say, if you don't have one of those pandemic babies, like they say on TikTok all the time. So she can talk about the pandemic babies for sure. Today, Amber's going to talk to us about her decision to get vaccinated while she was pregnant and to get boosted while breastfeeding, and how she's preparing to keep her family healthy over this holiday season. But she certainly has been doing all of the right things to make that happen. I'm going to moderate this session. Again, put your questions in the chat and we'll get going. I want to just start with Dr. Beers. Dr. Beers, as our pediatrician on the panel today, again, we're honored to have you. We're honored to always be in partnership with the American Academy of Pediatricians. What we know is that AAP has recently recommended COVID-19 vaccine for all children and adolescents and older who don't have any pre-existing medical conditions. Tell us more about AAP's recommendations. Make sure we know exactly what you guys are recommending for children, especially young children. And what are the factors and considerations that you all took into account as you were making your recommendations and making those decisions?
Yes, great. Thank you so much. Absolutely. Well, I'm first delighted to hear about the Grady connection with several of us. I was a medical student at Grady as well. So yeah, that's a wonderful connection. Thank you. And yes, absolutely. You know, and I'll talk a little bit about this, but the American Academy of Pediatrics recommends the COVID vaccine for all children ages 5 and up for whom there are no contraindications. And one minor clarification, actually, if you have a pre-existing medical condition, almost all the time you are eligible. So there are very, very few exceptions.
Thank you. I misstated that. So
no worries, no worries, no worries at all. You know, and in fact, there are, you know, always ask your doctor if you have questions, but there are very, very rare contraindications to the vaccine. But I'll talk for a moment about why we recommend it. You know, I'll say it's just as an overarching statement, and this has been true for the vaccine for 5 to 11-year-olds and for adolescents and adults. You know, at the AP, our experts, all of us together have really been watching the data and the process very carefully. We always take a look at it ourselves. We always watch the process. We feel incredibly confident actually in the review that the data that the vaccine has undergone all throughout the process, and we check it every time, and every step along the way we felt very confident. And so the reason we recommend the COVID-19 vaccine for all children and adults and adolescents and adults for whom they're eligible are really kind of three main reasons, and I'll just talk super briefly about each of them. It's safety, it's important, and it contributes to the community and helping our community get past the pandemic. You know, I'm a parent too. I'm a parent of 2 teenagers, and so the first question I always ask is safety, right? And we've seen, you know, across initially across the trials, but actually now we've had almost 5 million children ages 5 to 11 get at least 1 dose of the vaccine, and over 12 million teens who've been fully vaccinated across the United States alone, actually. And the CDC and the FDA are actually they watch this very carefully. They actually review the safety data every single week. And what we've seen is that this is a very safe vaccine. You know, this is a very safe vaccine, and the benefits of the vaccine really far outweigh any potential risk. You know, every medicine, every vaccine, everything has some risk to it, but the benefits of it far outweigh the risk. I think the second piece is that it's important. It can protect your child. This is, you know, also weighed heavily in my own decision as a parent. It can protect your child against what can be a very serious illness. You know, I think we hear a lot about how children are less at risk for serious illness than adults, and that's true, and that's really good. But I think sometimes what we forget is that children are less at risk for serious illnesses across the board. And when we look at actually the death rate for kids from COVID, it actually counts. It's one of the top 10 causes of death over the past year, and so that's, you know, that is significant. And I think also there's other things to consider besides death rates, right? There's you know, long-term impacts of COVID, long COVID, there's disruptions in school, there's just being sick for, you know, and feeling really terrible for several weeks or sometimes even several months. And I think also remembering that if you're a parent whose child gets very seriously ill, hospitalized or even dies, you know, that those numbers don't mean anything to you if you have a safe and effective way to prevent serious illness in your child.
Yeah.
And I think the third piece is really just it's a way that we can all contribute together to help bring this pandemic to an end.
Yeah, absolutely. You know, I want to ask you one quick question before we move on, and that is that, you know, I think it's been a huge relief to a lot of families to be able to have their children who are 5 years and older be vaccinated, but there still are those families who have very young children who cannot be vaccinated. And so how should families be navigating when some parts of the family are vaccinated, some actually are not eligible today to be vaccinated, but, you know, and now we've got Omicron, and it feels like we're going back to where we were, I mean, earlier this year when Delta was really on the rise. Just how should families with small children be thinking about keeping everyone safe during the holidays, especially when kids want to be out and enjoying Christmas and the holidays and all of that?
Yeah, no, it's such an important question. And I hear this from parents a lot, like, don't forget about our little kids. And absolutely 100%, we're not forgetting about them. It's, and I think it's part of why it's so important for all of us to get vaccinated and get our boosters, because if we're vaccinated, that really helps protect those around us who can't be vaccinated, or who may be more vulnerable because of their age or a pre-existing medical condition. So I think that's one an important thing. But I think the other thing is remembering that we've learned a lot over the past almost 2 years, and we know things that work to decrease the risk. Certainly, for children older than 2, wearing masks if you're in crowded situations or indoors with people who are not part of your household and you don't know their vaccination status. Doing outdoor play dates and outdoor fun things as much as possible. It gets a little harder in the winter. I know we've done some stuff out in really cold weather with our kids for sure, but it seems to bother us more than it seems to bother them, actually, as adults. Thinking about what things are most important to you as a family, and really prioritizing doing those things, and doing those things carefully and cautiously. I think another tool that can be very, very helpful, particularly when it comes to family gatherings, because you want to be together. It's so important that the little ones want to love on grandma. We all want to be together, and so another tool in that is testing before you get together, because it's not perfect by any stretch of the imagination, but it gives another layer of it just adds another layer of caution and comfort to knowing when you're getting together. If you've been tested right before you get together, it adds that additional layer. So.
Yeah, using all the tools we have available to us. So I want to come back to you about the 16 and 17-year-old kids getting boosters, but I'll come back to you about that. But I'd like to go to Dr. Baker and bring her into the conversation. Dr. Baker, as an OBGYN, obviously you're interacting with a lot of pregnant and women that are giving birth through the pandemic. What are you telling your patients about not only getting vaccinated, but about the booster at this point?
Well, I think that is such a huge question for a lot of pregnant and nursing patients. They are really wanting to know about COVID-19 vaccination, and I am without a doubt telling them to get vaccinated. Our big kind of governing bodies are the American College of OBGYNs and the Society for Maternal and Fetal Medicine. And both of those societies recommend that pregnant and nursing women get vaccinated. And so we are recommending that wholeheartedly, because now after this Delta variant, we have seen some awful outcomes for pregnant and nursing folks. And that has definitely spurred my enthusiasm for talking to every pregnant and nursing person about getting vaccinated and getting boosted. So just saying, hey, the anxiety that comes with or a relatively new vaccine when you're pregnant or when you're nursing, but we have to keep our eye on the ball here in terms of the potential for really poor outcomes for pregnant and nursing people when you're talking about actually getting COVID-19 infection. And we know that pregnancy can be a really high risk period of time for folks when they get respiratory illnesses like COVID-19. So we have to think about safety first. And if you have to take a chance on the vaccine and not on the disease.
Yeah. And so just another question on that. When you talk to your patients and they seem hesitant or they're not sure, or they kind of are leaning against getting the vaccine, what are some of the concerns that what are the most prominent concerns that they're raising with you that they have that are, and what's causing them to be so hesitant at this point? And how do you help them get past that?
I think the biggest thing is that there is just so much misinformation out there about COVID-19, about the COVID-19 vaccine, about Operation Warp Speed. So I think that really bringing the science to them in a way that they can digest and understand it is so important. And so describing how the vaccine was developed, what's in the vaccine, how the vaccine works is very helpful. And then kind of debunking a lot of that misinformation. So we just sit down and we talk about it, and we talk about the risk versus the benefits. And when we can identify that the benefits vastly outweigh the risk, most of my patients have been very willing to go ahead and be vaccinated. And I think that's really the thing, is that this has to be about shared decision making, and we have to be able to meet folks where they are and say, what are your concerns?
Yeah.
Let's talk about them. Let's talk about what the real risks are.
Yeah.
So
And
I
I think
think
it makes
that,
it
that's worked well for me.
that's really great. I think it makes a difference when, they're hearing it from you and they trust you. And for a lot of us, when our doctors who we trust with our lives tell us the right thing to do, it can definitely help calm fear. So everyone should really talk to their healthcare provider. I think it's a good thing to do, and get the right advice, not just relying on any information that's out there on social media or wherever you're getting your information. It's really important to go to somebody you trust who is trained and really knowledgeable about these issues. So thanks for that, Dr. Baker. And again, we'll come back to you too. Oh, go ahead, Dr. Baker.
Absolutely. Well, I was going to say, one thing that I think is really important to share, especially in a public forum like this, is that when we think about that the COVID vaccine is experimental, so are all of the treatments that we're using for COVID, right? So we always want to kind of talk about that. And I tell my patients that all the time. And that's usually a game changer for a lot of people. I'm like, thinking about monoclonal antibody use and all of the treatments that are available in hospitals, those are also very experimental. So if you experiment with something, the thing that has the most data behind it is actually the vaccine. So I think that's also a really great point when you're talking to someone who has.
That's a great point. I hadn't thought about that, but you're raising a very good point. And Steve, that kind of gets to you, because here's the thing. People have been reluctant to get vaccinated. They've had concerns. They're waiting for the research. They're waiting for more information. They get sick. They end up in the hospital. And your hospitals that you work with every day, hospitals around the country, nurses, staff are overwhelmed. They were overwhelmed. It got a little better. They're starting to get overwhelmed again. And I know it's got to be frustrating to a lot of folks in the hospital, in the hospitals that are working to literally save lives every day. So what are your hospital administrators and staff and docs and nurses in the hospitals, what are they experiencing right now? What are they really wanting to say to people about staying safe during the holidays, vaccinations, and all of that?
Thank you. And Stacy, thanks so much for asking me. It's a real honor to participate. Before I start and answer your question, I'd be remiss. I also have a connection to Grady. John Harper is a good friend. He's the CEO there.
Yes.
And he was board chair when I was hired here at the DFW Hospital Council. So what we're really doing is putting enormous pressure on Amber, because she'll be the only person if she's not connected to Grady. So I can't wait to hear from her on that. I do want to go back and comment on Dr. Beers. I'm a layperson. She's a physician. Dr. Beers, what I try to impress on people for the 5 years of age and under, we have a responsibility to build a cocoon around them. And we did it pre-COVID when we told people, if you're going to see a young infant just born, make sure you have your DPT shot. So how is this any different? We all have a responsibility to protect those young children, and that's why we should get vaccinated. And that's what I try to tell people as well. Now, to answer your question, here in North Texas, we're very blessed. We've got 90 hospitals that are part of the DFW Hospital Council. Many of those are large systems, and they do compete. Let me just tell you, they want each other's market share. But during the last 2 years in dealing with COVID, They have come together, worked collaboratively, and have done what's best for the community. And I give kudos to all the hospitals, all the leadership in the hospitals, not only the CEOs, but the chief medical officers, the chief nursing executives. Everyone in this community is pulled together to do what's right by the community. Now, with that said, you're exactly right. We've experienced 4 waves here in North Texas, and one of the waves got really, really to the point we thought it was going to be almost time to break because of bed capacity, because of our staffing issues, but we all pulled together, cooperated, and we did weather the storm. What's going through the minds of many of our clinical people and hospital executives is this: we're worried about Omicron. We're worried about what was seen at Cornell University just recently and how quickly it spread. Here in North Texas, we're still treating 850 people with COVID-19 in our hospitals. Now, that sounds like a lot. During the surge, it was close to 5,000. So we're much less, but unfortunately, we've ticked up about 100 to 150 patients since Thanksgiving. So we're really worried about coming off of Thanksgiving. In a week and a half, we've got other holidays coming up, as you know. And then, of course, we've got this threat of Omicron. So what we're trying to do is get the word out. We do have healthcare heroes, but they're tired, they're fatigued. They've been at this for 2 years. Kudos to all the clinical people, not only here in North Texas, but throughout the United States. I think one of the things we learned here in North Texas was community disparities. We do a lot of analytical work here at the Hospital Council. We can go to zip codes where you look at the social determinants of health, whether it be related to housing, transportation, education, all of the things that impact the health of a community. You can almost overlay the density of the COVID-19 cases in those same zip codes. So we've got to do a lot of work on disparities, health equity, and do everything we can to help people to prevent a 5th wave. In Texas, unfortunately, we have not expanded Medicaid. We do have coverage and access issues, but we're going to continue to work together so that we can beat COVID and deal with health inequities.
Well, and it's interesting. I was just thinking about the fact you're in Texas, Dr. Baker, you're in Georgia, Dr. Beers, you're in DC. Amber's actually doing a little bit better in California, where there's been a lot of progress on maternal mortality with the California Omnibus Act and a lot of things, but obviously still some challenges there. Amber, you seem to just be the star of the show. I don't know, maybe that's just because you are always the star of the show, but I was going to say that you know, a lot of us on here are in areas that are were deeply impacted with the maternal and infant health crisis even before the pandemic, and they were because of those things, Steve, that you just talked about, social determinants of health that were already impacting everyone's health, especially women, especially new mothers, pregnant people, and now a pandemic layered on top of it. It just means that we've got to make sure that everybody has equal access to information, trusted information, that the hesitancy they may be experiencing, that we have a way of helping to calm their concerns and answer their questions, but making sure that people are encouraged to protect themselves and their communities, because we just don't need more devastation going on in some communities that have already been experiencing, you know, a high degree of mortality, morbidity. And those are some of the issues we've been working on at the March Times. And so I'm glad to hear you raise that. I do want to go to Amber. Thanks for being patient, Amber. You're so wonderful to be on to share your experience as a mother of a newborn baby as well as a toddler. And so tell us what that experience has been, and tell us what your decision making was like and what it felt like with you and your family, your husband, for you to get vaccinated and for you to get boosted all during this period of the pandemic. And how did you think about that in terms of protecting yourself and your family?
Yeah, well, first of all, thank you for having me here, because I think it's one thing to hear all this information from doctors and professionals, but I think it's also important for someone like me who has like firsthand experience as a normal human being who doesn't have like a degree in medicine to talk about how this has impacted my life and in such a positive way. So I'm glad that I can speak on this today, especially for other people who are pregnant right now or trying to get pregnant or breastfeeding. So I got pregnant. We had already been in the pandemic for about 9 months at that time. And so I had been living through all the fear that we had been all dealing with and staying home and just praying that a vaccine would come along. But we decided to go ahead and try and get pregnant anyway. And what happened is the vaccine started to roll out right around my end of my first trimester. So that's when I went to my doctor and started talking to him about what was going on, what was being developed. And he told me with such certainty how confident he was in me getting the vaccine while I was pregnant. And he was giving me statistics of what was going on at the hospital where I see him. And he was talking to me about how the beds were so full and all these people were coming in, they were very ill. And giving me numbers of how many people were coming into the hospital every day and every week. And then as I kept seeing him, because I would go every couple of weeks for my checkup, he was talking to me about how the treatments for COVID and the vaccine were starting to diminish the number of people that were taking up beds in the hospital. And then talking about how overseas, they had started the vaccine rollout earlier than in the US, and how they had so much data on all these different people and women who were pregnant getting the vaccine and who were and people who had gotten COVID during pregnancy and all this data that was coming in from around the world. And because of all of that, he was very confident again in his patients getting the vaccine. So because of his confidence in it, that made me feel so confident going into it. I knew that I had at the time a 2-year-old at home that I wanted to protect. And my childcare is my parents who are older and my husband's grandmother. So my daughter's great grandma. So I needed to protect them as well. So I, without any hesitation, went ahead and started the process of getting my 2 vaccines. And was never really concerned about my baby inside me because my doctor didn't seem to think that there was anything I needed to be worried about. And then she was born perfectly healthy, right on time, great big baby, very happy and healthy. And so I just got my booster a week and a half ago. And before I got it, I did call my doctor's office and I was like, I'm just double checking. I know you're going to tell me to get it, but I'm just going to double check because I don't know, just a peace of mind. And gave him a call and said, look, I'm going to get my booster. Is there anything I need to be concerned about, or what are the benefits? And again, was very much encouraged to do so because, as we all know, the booster is something that we all should be getting because the efficacy of the first shot we got is now diminished. And so we want to continue to protect ourselves and to protect my newborn because she will be getting antibodies that aren't as strong as when I got the shot, but still there's something that she will be consuming through my breast milk. So I went ahead and got that. And because I've got the booster and my husband, we're protecting our 3-year-old. So I'm just really grateful that it all exists because all of that to say, we got COVID last week. And we sure did. So because we were vaccinated, we felt more comfortable kind of going out into the world and doing things. So I don't know for sure if this is where we got it, but we did go to Disneyland. And that was the most people that we've been around in a long time. And it was quite crowded. So it's likely that, that's where we picked it up. But I'm really grateful because my husband had literally 0 symptoms. I felt like a little tired. And I was like, I don't know if I'm sick. And then everyone around me was like, oh, there's a cold going around. There's a cold going around. And I took a test one day very, very early and it came back negative. I was like, oh, I got the cold everyone got. So, my symptoms were so minor. And it wasn't for another week that my daughter took a really long nap. And I was like, that's unusual because my kid is wild and has a lot of energy. And so we're like, let's get a test. And she had a little fever. And so she came back positive. I came back positive. My husband came back negative. So his booster, he got a little bit before I did. And so I think his was like really kicked in, and I had only had my booster by that point for 5 days. So it hadn't, I'm assuming that's why I still had like a little bit of symptoms. But all that to say, we're perfectly healthy. We're not going to the hospital. We're fine. We're moving through this. And I think that's the whole point. That's why everyone needs to get their shots and their boosters, because this virus is still out there and it's still affecting all of us in our lives. But if we all get this vaccine and we stop filling up hospital beds and we can be healthy, then we can move back into our normal lives again.
Yeah. And your baby was healthy. Your baby.
And my she has no symptoms, none at all. So I'm so thankful that I had a doctor that really encouraged me to do these things and in a timely fashion, so that I can go into this holiday season. I mean, I'm still in quarantine right now, so I'm just at home. You can probably hear my kids yelling downstairs. But I'm gonna just stay home for another couple days and then I'm done. And then I can go into the holidays and I can feel confident being around my family again. Yeah, so
that's great.
That's my story. That was a really long story.
Oh, no, I think it was so helpful. Because actually there's a question that kind of dovetails on what you were saying, and you might want to say something, but also Dr. Beers, I think, and this comes from Facebook, I think I'd like for you to address this as well. Because Amber, it sounds like something that'd be relevant based on your story. The question is, I have an 11-month-old son who was born 3 months premature. My husband and I do our best to protect him from COVID-19. We're both vaccinated, and I just got my booster today. What precautions do you all recommend for the upcoming holiday, being around vaccinated and unvaccinated extended family members? And I think the twist there, for at least for me, is that having an 11-month-old son who was born prematurely. She doesn't say this, but maybe I would assume from that there are health concerns that maybe she may have, or that she may have around this baby that was born prematurely. So Dr. Beers, do you want to take that, and just how would you respond to that?
Yeah, absolutely. Sorry, it took me a moment to get off mute. I have a loud dog running around the house, so I've been staying on mute. Yeah, I mean, a couple of things, and I think, and Amber, thank you for sharing your story. I mean, there's so many important points in there, and I think, a couple of things I'll note, particularly from the question from our viewer on Facebook. First and foremost, right? And I think we alluded to this earlier, but if you are a child or an adult with a pre-existing medical condition, you can be at higher risk for more severe outcomes from COVID. And so I think, one thing is, in any situation like that, really talking to your doctor and just talking that through and getting a sense as to sort of what the risk for your family is, because that's going to also impact kind of how comfortable that's just going to impact how comfortable you feel. We all, sometimes we talk about, right, like, you're always balancing those risks, right? And you're thinking about what's important for our families and our families' health and mental health, and how much risk are we taking on by exposure to COVID, right? And so the knowing and understanding your personal family's risk profile is so important in that. And I think with the question about, with holiday and vaccinated and unvaccinated extended family members, and I know this can be a touchy subject in families, but the first thing is, would they be willing to get vaccinated? Maybe with Omicron, maybe with the new baby, with the baby, they might be willing to do it. You never know, right? It's always worth bringing up the conversation. But sometimes that's sometimes out of our control, right? And so then thinking about what are the things you can do to decrease that risk. I do, as I mentioned before, I think testing can be really helpful. And Amber, I think that was an important piece of your story, is that you guys thought about it and you said, oh, we feel funny, right? Like, so let's get tests, because if we know what's going on and we know early, then that helps contain the risk for ourselves. It helps contain the risk for the other people in our family, for the other people in our community. I want to acknowledge that it's not actually always easy for everyone to get a test, right? Testing availability is variable in a lot of different places. There are over-the-counter tests, which are very, actually quite good, but can be pricey. But if you can and you have access, frequent testing under these circumstances can be really, really helpful. And again, I think particularly if you're going to be with unvaccinated family members, asking them to do tests before you get together. I think masking is again, nothing in this world is perfect, but masking is a really good way, wearing masks, to decrease the spread of COVID and to decrease the risk if someone does have it and aren't showing symptoms yet. So that's another really important thing. We also know being outdoors, I don't know where our the person asking the question is, maybe they live somewhere a little more temperate and that's a little easier to do, be outdoors, but outdoors is always lower risk than indoors. So those are all things to kind of think about and balance. And I think, most importantly, if you do have questions and you want to sort of talk through those things specific to the risks in your family, don't hesitate to reach out to your doctor and talk those things through, because that's what we're here for.
I think that's right. And one of the things about Amber's story that was really striking, though, and I think this is what a lot of families, experience, which is we're trying to get vaccinated and do the right thing. We're taking the guidance that's given to us, but we're also trying to live our lives normally, and especially for kids, right? Especially for kids to try to get back to some degree of normalcy. Taking your kids to Disneyland is kind of what, your kids don't understand the context of this pandemic. All they know is that they want to enjoy their lives and go back to what they, just having a sense of freedom to move around. And then we're faced, like Amber, you were faced with the idea of like doing some of those things, having been vaccinated and still get sick. And so I think there's just a reality that we're facing right now, that it's not one thing that we have to do in this. It's going, Dr. Beers, what you're saying, it's multiple levels of protection, right? It's vaccination, masking, washing hands, it's doing all that basic stuff. And that this is just maybe, the way life is. And Dr. Baker, I just would like to ask you about that, because I think that's the one thing for pregnant women that are still thinking about being vaccinated or not being vaccinated, or if a breastfeeding person's thinking about this, there's still got to be multiple things that women think about, and that's adding to the stress the pregnancy already presents, or having a newborn is already stressful. And can you just talk a little bit about what has happened, do you think, with the mental health of a lot of your patients through this period of time? And Steve, you might want to chime in. Amber, I'd love for you to chime in after that too, just because the reality is this has been incredibly stressful, and that's having a big effect on a lot of us.
Yes, and I'm so glad that you brought that up, because it's such a huge mental load to carry. Number one, being pregnant or having a newborn during the pandemic, and then having to, think about and second guess every single thing that you do, every person you come in contact with, thinking about the vaccine or, possibly getting a life-threatening illness, and then what's going to happen to my baby or my other children who are home. So it's a huge mental load to carry, and it's very anxiety producing for a lot of folks. And so certainly this is a time, if you are not doing it, or you've not been doing it before, to start talking about that with your OB care team. If you are dealing with anxiety, with depression, isolation has certainly been at all-time highs. People are staying home, they're not able to get out to do their normal activities. And it really has been very difficult. A lot of folks have been reporting not feeling like themselves, feeling sad, not being able to commune with family or friends. And it's really taken a toll. And we've seen so many people, I think people have called anxiety and depression the silent pandemic that's, kind of been running in parallel with the COVID-19 pandemic. And so it really is so important for us to talk about our mental health and challenges that we might be having with that, particularly in the perinatal period, because it's just such an important time for us to support moms and to help them you know, have what they need to be able to parent their babies.
Yeah. Steve, did you want to chime in on that too?
Sure. I totally agree with everything Dr. Baker said. And I will tell you what we've experienced, especially in North Texas, because when I've talked to some of the psychiatrists and also psychologists, there's been a big increase, obviously, in depression. Unfortunately, our teenage and adolescent attempted suicide rate is the highest it's ever been. A lot of this is attributed to what happened with COVID. You know, some other things that have caused stress, if you go back to say June, July, and August of 2020, people were afraid to come to the hospital for fear of catching COVID. So we had people dying at home of heart attacks and strokes. 911 calls dropped tremendously, and we know that it was because people were afraid to call. That added to the stress. The other thing we've seen also is the stress of our own workforce. You know, treating COVID and having the burnout that many of the clinicians have gone through has caused emotional and mental stress on them. And then the other thing, and I don't know if Dr. Beers and Dr. Baker have seen this, but workplace violence in hospitals is increasing tremendously by patients and patients' families, different political views on whether you wear a mask and get vaccinated. So when you put all of that in the mix, it's been a very stressful 24 months. And I'd love to know if Dr. Baker and Dr. Beers have noted increased workplace violence in the institutions they serve.
Yeah, I mean, I can chime in, you know, and I appreciate you bringing this up. You know, clearly pediatricians are the group that I am most connected with, and it's been a real, it's been very challenging. You know, like if you've got a pediatrician out there, please give them some love right now, because they're working so hard. They've been working so hard for 2 years. They're busy, they're testing, they're taking care of vaccines and mental health concerns and other respiratory illnesses. And I think you're right. There's you know, they've been experiencing a lot of hostility in a lot of situations, and just for doing their jobs, and it's been really, really hard. And I think we're all doing everything we can to support them, because it's I say this a lot. I've never been more honored to represent a group of people in my life, because what I've seen out of pediatricians over the past 2 years is amazing. They have over and over and over just done whatever they could, however they could, to make sure they were taking care of the kids and families in their practices. And it's been very stressful. So I appreciate you bringing that up.
And I would certainly echo Dr. Beers, Steve. We have definitely seen it. And one of the unique challenges for OBGYNs is that we have two patients that we always have to think about. And when it comes to COVID, the big challenge for moms is that they have decreased respiratory reserves, because you have this big pregnant uterus that's kind of pushing up on the diaphragm, and the lungs can't fully expand to their full capacity. And so they are supporting not only their own internal organs, but they are supporting another full human being. So it can be very challenging to provide oxygen for that mom and for that other person that's living inside that mom. So it can be very challenging, and weighing the risks and the benefits of that can be mind-boggling. It's like, okay, I've got this little person, and then I've got this full-size mom, and I got to figure out how to provide enough oxygen to sustain both of them. And what has happened, and I'm sure Stacey, Bradley, you guys have been tracking this at the March of Dimes, is that babies are being born preterm. We're having to, you know, weigh the risk and benefits, and a lot of times it's okay, let's see, we've got to have this baby born in order to keep this mom alive long enough to provide supportive care for her and improve her respiratory status. Yeah. And then we just have to deal with the baby's respiratory status in the NICU, right?
Yeah, that's so scary.
Yeah, been very scary and very difficult. And of course, everybody's emotions run high, and workplace violence is something that everybody's dealt with. And I've been very glad to see the additional training that our system, I work for a large health system in Georgia, Wellstar Health System has put additional training in de-escalating that and kind of breaking down those emotions and helping both the staff and the patients and family members kind of deal with that and help us de-escalate situations to try to avoid that. But it certainly is a reality, I think, across the country and probably across the world,
So
unfortunately.
that's really scary. Here we just assume that if any of us get sick, that we can just show up at the hospital and everybody's ready to serve us and meet our needs. I don't think we give enough. I don't think we give enough gratitude and thanks to our healthcare providers for all that they've done to help protect so many people, especially pregnant women trying to give birth through the pandemic. Amber, I want to just come back to you though, because as you were telling your story, I was thinking, wow, she sounds so put together, like it was all just sort of came so easily for you. But I would imagine that you had a lot of nervous moments and sleepless nights, and that it's been an incredibly stressful time for you just trying to manage through this with your baby and a small toddler. So how have you been dealing with that, from not only just keeping things moving in your household, but just mentally, and how have you been able to manage with your own self-care and keep yourself protected, not just being vaccinated, but just from a mental health perspective as well?
Well, I will say in general, I'm a pretty glass half full person. I have a lot of just like gratitude for my life and the people around me, and I just took everything day by day and waited for my doctors to tell me what to do next, and just stayed put when I needed to and got vaccinated when I need to. But I will say getting the vaccine lowered my anxiety immensely. And I think that I think pregnant women should really listen to that. Because there's already so much anxiety that comes with just being a pregnant person outside of this. Because I had a baby before there was a pandemic, and that was hard. But having a baby now, when there's this risk just leaving your house for you and for the baby that you're building, once I got the vaccine, I felt such relief. Like I felt really protected, and that I knew that I was going to, that I had made the right decision, and that I could kind of go back to resuming my normal life with less concerns. So if you are pregnant out there and you're feeling anxious about getting it, but you do want to, but you're anxious, just do it. Just do it. You will feel immediately better that you made that choice for yourself and for your family.
Sounds awesome. Let me just say this, that we have, at the March Times, we are launching a national campaign to close the gap on something else that we haven't really touched on today, and that's routine immunization. So we've been talking a lot about COVID-19 vaccinations, but I think a lot of people forget that normal immunizations that happen for babies, for children over the same period of time have really fallen off. And then that's introducing a whole nother level of risk and some other issues that we hadn't had to deal with for a long period of time. So we're trying to really remind people that it's not just COVID-19, the flu, that you got to be immunized against. It's also your children have to stay on track with those normal routine immunizations. And that's especially important on the issue of health equity, as Steve raised earlier. I mean, the disparities that we're seeing around missing those immunizations are showing up in some of the same communities that are already sort of missing in terms of access to the vaccine, the COVID-19 vaccine. So this new campaign is really about making sure that we can educate moms and families around all of those recommended vaccines, reminding them how important they are. And really enlisting a network of our partners and healthcare providers and community leaders to join us in reminding families about the importance of this. And we just want to take a moment to make sure everybody is reminded about that. Before we close out, we just have maybe 1 or 2 minutes. Are there any quick little closing remarks that you'd like to share with folks as we're moving into the holidays? just quick little snippets of what everyone should remember to do to keep everyone safe during the holidays. Dr. Beers, you want to start?
Absolutely. You know what? I think the one thing I would say that we've touched on, but we haven't gone into great detail is get your booster shot. With the rise of the Omicron variant, I think this is quite important. I think one thing it's important for us to remember, this is really routine with vaccines. Actually, it's sort of how vaccines work. They often need booster shots. I mean, almost all of our routine childhood vaccinations need booster shots because that's just how our immune systems work. And so this isn't out of the ordinary, but it is really important right now. And I'll also say we do definitely recommend it for 16-year-olds and up. My 16-year-old is scheduled for hers, and so I absolutely recommend it. And this is the perfect time to do it right before the
I think your
holidays.
dog is saying that they need a booster shot too. They just came in right there.
I know. She likes the conversation. She agrees with that sentiment.
That's right. She says, good job, Mom.
She wanted to make an appearance.
That's right. Steve, any last quick parting thought?
The physicians have done a great job, and Amber, on the importance of vaccinations. So I'm going to pivot a little bit. Don't forget your flu shot also.
Ah, yes. Don't forget the flu shot. And Dr. Baker.
I'm just going to say, be vigilant about wearing your mask, washing your hands, and social distancing when you're in enclosed spaces and not with the folks who live in your household.
Very good. And then Amber, what would be your closing advice to, especially to new moms, pregnant and breastfeeding women that might be listening?
I'm just gonna say ditto to everything everyone else said. And I do want to say that it is super important to go get your booster. I think I have a lot of friends even who are hesitant. I think they just don't understand what a booster does and why it's important to get it. But correct me if I'm wrong, but basically the efficacy of the shot that you got before is not really protecting you that much anymore if it was over 6 months ago, and even less if it was, a certain vaccine. So just make sure that you get that and give yourself ample time for it to start working in your system before you start to feel really confident, spending time indoors with people, especially those that may not be vaccinated.
Absolutely. Well, listen, thank you all so much. You guys have been fantastic. And as usual, we have a whole host of resources that we've referenced or that are available to you. I mentioned the campaign that we're promoting around vaccine confidence and building knowledge and trust around all of the routine immunizations that children need to have. I've talked about that. I want to make sure you know about the other resources as well. We have a COVID-19 page on our marchdimes.org page that gives a ton of information. And we also reference a lot of our partners, like Dr. Beers is the head of the American Academy of Pediatrics. There are tons of links to their organization, to ACOG, as Dr. Baker mentioned, SMFM, another organization that we work with very closely, and CDC obviously has a lot of information that could be very helpful to moms and to families. And then as usual, we have a ton of other parent resources as well. And the last thing I'll just say is that a lot of what makes it possible for us to do this kind of work that we're doing today and all the other work we do at the March Dimes is your support. And what I would ask is that now that the end of the year is coming and you're thinking about end of year contributions, we hope you'll remember March Dimes. We hope also you'll be a part of becoming an advocate for maternal and infant health. And you can do that by going to our website and signing up for our campaign. There's a lot of legislation that's pending and trying to make its way through Congress right now. And we really, really need your voice on especially a bill called Momnibus that's all about addressing some of the gaps and the equity issues that we face with respect to maternal and infant health. So there's so many ways to get involved, not only getting information from the March Dimes, but supporting us in multiple ways. We're so grateful for all the things that you all do to help us every day. And I'm certainly grateful to this panel for being so wonderful and so amazing and providing such great information. So thanks for joining us. We hope everyone will have a very healthy and very safe holiday, as we've been trying to encourage everyone to do. Get vaccinated, get boosted if you're eligible, and keep your family as safe as possible. So thank you all so much. Thanks to this wonderful group of panelists, and then we'll see you in the new year. Thanks.
Thank you so much.
Thank you.